Welcome to our hairdressing and barbering level 2, health and safety course. This session relates to topic 5, first aid. Introduction. First aid can save lives and prevent minor injuries becoming major ones. First aid may be carried out in any situation where injuries or illness occur. In many cases, the first person on the scene is a volunteer who wants to help, rather than someone who is medically trained. This session covers 1. Duty of the employer. 2. Appointed person. 3. First aider. 4. First aid box. 5. First aid needs assessment. 6. Qualifications for first aid. 7. Accident book and recording. Duty of the employer. Under the Health and Safety, First Aid, Regulations 1981, employers have a legal duty to make arrangements to ensure their employees receive immediate attention if they are injured or taken ill at work. It doesn't matter whether the injury or illness is caused by the work they do. What is important is that they receive immediate attention and that an ambulance is called in serious cases. Employers have a responsibility to carry out an assessment of their first aid needs, based on hazards and risks involved in their work. Duty of the employer. The minimum first aid provision must provide 1. A suitably stocked first aid kit. 2. An appointed person to take charge of first aid arrangements. 3. Information for employees about first aid arrangements. The aim of first aid is to reduce the effects of injury or illness suffered at work, whether caused by the work itself or not. The first aid provision must be adequate and appropriate in the circumstances, and this means that sufficient first aid equipment, facilities and personnel is available at all times to provide immediate assistance to casualties with both common injuries or illnesses and those likely to arise from specific hazards at work. Call an ambulance or other professional help. The appointed person. First aid is the initial assistance or treatment given to a person who is injured or taken ill. When an employer's first aid needs assessment indicates that a first aider is not required, they must appoint a person to take charge of the arrangements. The roles of this appointed person, AP, include 1. Looking after the first aid equipment and facilities. 2. Calling the emergency services when required. An appointed person can also provide emergency cover for an absent first aider. They do not need any formal first aid training, for example FAWF or first aiders. People at work can suffer injuries or be taken ill. It doesn't matter whether the injury or illness is caused by the work they do or not. It is important to give them immediate attention and call an ambulance in more serious cases. A first aider is someone who is trained to be fully competent in providing initial assistance in emergencies. They will hold a valid certificate in either Emergency First Aid at Work, EFAW, or First Aid at Work, FAW, standard. Question. Which of the following is stated as a minimum first aid requirement? True or false? Under the minimum first aid requirements, there must be an appointed person to take charge of first aid arrangements. Question. What is the aim of first aid? How many first aiders? An employer decides how many first aiders they need after completing their first aid needs assessment. There are no fixed rules on exact numbers, but here's a guide. 1. In small, low-risk business like salons and barbers shops that employ fewer than 25 people, the employer needs an appointed person, AP, to take charge of first aid. 2. For a larger, low-risk business employing between 25 to 50 people, will need at least one first aider with the Emergency First Aid at Work, EFAW, qualification. 3. Large low-risk businesses with more than 50 employees need at least one first aider, trained to first aid at work, FAW, standard, for every 100 employees. How are they trained? First aid training is available from the wide range of training providers. These include 1. Those offering nationally recognized, regulated qualifications in FAW and FO. 2. Voluntary aid societies, St. John Ambulance, British Red Cross, and St. Andrew's First Aid. 3. Those operating under voluntary accreditation schemes, or operating independently. Topics covered in training. Qualifications in First Aid. 1. Emergency First Aid at Work, EFAW. 2. First Aid at Work, FAW. Question: which of the following is the lowest level of medical first aid qualification? Question: which of the following is the highest level of medical first aid qualification? Question: which of the following are roles that an appointed person performs? Question: which of these is a recognized provider of first aid training? First aid needs assessment. Checklist for employers for their first aid needs assessment. An employer considers the following for their business. Take a look at the points to consider. Assessment of first aid needs. The points covered here form a checklist for assessment of first aid needs. Question: what hazard level are shops, offices and libraries normally categorized as? First aid box. What should a first aid box in the workplace contain? The minimum stock of first aid items should be 1. A leaflet giving general guidance on first aid. For example, HSE's leaflet Basic Advice on First Aid at Work. 2. Individually wrapped sterile plasters, assorted sizes, appropriate to the type of work. 3. Sterile eye pads. 4. Individually wrapped triangular bandages, preferably sterile. 5. Safety pins. 6. Large sterile individually wrapped unmedicated wound dressings. 7. Medium-sized sterile individually wrapped unmedicated wound dressings. 8. Disposable gloves. Accident book. All accidents in the workplace must be recorded, however minor they appear to be. Minor accidents are recorded in an accident book, whereas more serious accidents are recorded in a different way. Accident book entries should include 1. Date, time and place of the incident. 2. Name and job of the injured or ill person. 3. Details of the injury/illness and any first aid given. 4. What happened to the casualty immediately afterwards? For example, went back to work, went home, went to hospital. 5. Name and signature of the person dealing with the incident. Accident book. This shows the typical information needed when recording accidents. Well done. In the session you covered the following first aid aspects. 1. Duty of the employer. 2. Appointed person. 3. First aider. 4. First aid box. 5. First aid needs assessment. 6. Qualifications for first aid. 7. Accident recording.